Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to just share something that has just been working really well in the office these last few days and has reduced my stress. It's helped me to be able to document more within the treatment room, and it's just all around kind of made my life a lot easier. This is something that I call patient presentations, and I've been talking about this for a couple of years, and it's kind of gone through different renditions. And if you've been listening to me for a while, you know how it's been working. Basically, what they are, these are PowerPoint presentations that I used to do with the patients in the office. But recently, I learned from Neil Baum. Basically, he recorded them and he gave them to patients. He used to actually roll in a television in the treatment room and have them watch it. Well, we have little iPads now, and it's working really, really well. So let me explain the workflow today. So for example, today, just like all you guys, I saw 3 patients with hallux limitus, and I thankfully just made a video recently. If you go to my YouTube page, you can see the video. It's on hallux limitus. It's about an 8 or 9 minute video, and it is actually those slides in a video format. And so basically I went in with the patient. They told me where their joint pain hurt. I looked at it, I looked at the x-rays, and I said, okay, Mrs. Jones or John, I'd like you to watch this little video. While they watch the video, it's me talking for like 10 minutes, and the same thing that I used to explain every single day for 10 minutes. Or if I didn't have enough time, I explained the 2-minute version, but it gives them a really good presentation. And while I'm talking on the video, I'm actually commenting, okay, you have moderate arthritis in that joint. You do have a first-ray elevatus. You don't have a first-ray elevatus. And I'm commenting, but the cool thing is now I can use that time to document my note. So I document the note, I put in the x-ray read, I do the whole documentation, I put in the ultrasound guided injection that I'm going to do. I send them the information on Patient Education Genius, so if you haven't heard the one on Patient Education Genius, that would be a good one. And I do all of that, and then I'm usually even done with that before they finish the video. So then I leave, and I might go see like a paronychia follow-up or another patient visit, and when they finish, either my staff can hear it because the video stops, or I tell them to open up the door when they're finished. I'll go see another patient, then I'll come back, and then I'll do the ultrasound-guided injection or whatever I'm going to do at that time. And so it works better, in my opinion, for new patients. Okay, so I don't tend to use it for follow-up patients. The follow-up patients, I'll still pull up the presentation and I'll show them just that checklist that I've talked about before. Basically, it's a checklist for everything that I treat. I have a checklist, and I just say, hey, what's worked, what hasn't worked, what we do. So that's the process. And then I also use my little, I have a little notepad, kind of like a prescription pad of how I treat things. And this is just kind of another iteration of how they're going to be treated, because patients just don't remember anything. And even if they do watch the video. And then I send them a copy of that video on Patient Education Genius. So as I'm perfecting this whole process, I am sharing it with you guys. If you have questions about how I do this, I want to be very clear. I had big reservations in the beginning. Okay, I'm like, no patient's going to want to watch my video. They're going to critique me. I don't want to listen to myself talk. All these things. But hey, just try it one. Just do one. Do one. My first one was on plantar fasciitis. My second one was on Achilles tendonitis. My third one was on nail fungus. So I had a patient watch a nail fungus one today. And so all these things that we see, you can do a stellar presentation, and you can record it, versus you doing the abbreviated one and not really complete one when you're with them, because you might not have the slides, you might not, any number of reasons. You don't have to do your own. If you do want to use mine, they're part of that Podiatry Practice Mastery. So you join and you can get access to my videos. Now, I'd like to know your feedback, because I don't know if you guys would have a reservation to use my videos. I don't care if you use my videos or my presentations, but you might have a reservation to doing that. Let me know what you think, because if there's a big enough demand, I can make a generic one. Or I guess I could teach you guys how to do your own. You just do StreamYard, or you stream it on Zoom as you're talking. If you're high tech, you can do that, but it might be easier just to use my own. Or if you want to try one of mine once, and if we have a similar treatment style, you just let me know how I can kind of make it better. Okay, guys? Once again, join Podiatry Practice Mastery. I'd love to get your feedback on things, and I hope you find this beneficial.